everyone, it's Caitlin here from New South Wales Health. So today you'll hear 3 different educational talks. So first of all you'll hear from myself. So I'm a Health Promotion Officer from New South Wales Health, and I'll be talking to you on a topic around sexual health. The second person you'll hear from is Anna. So Anna's a clinician at Headspace Wollongong, and she's going to be talking to you about all things mental health. And the last presentation will be from Pippa. So Pippa is a health education officer here with New South Wales Health within the Illawarra drug and alcohol team. So normally what we do is we come into campus and we talk to you guys face to face. They're normally quick 15-minute chats, and then after it we generally stay back. But due to the current climate and not doing much face-to-face, we've decided to do this online WebEx. So hopefully you will find it really helpful. Unfortunately, we are all used to having a crowd where we can ask questions and kind of find out what people want to know more of. So today we've just put some things together that we think, 1, is important, and 2, you will all find interesting. All right, so let's get started. Oh, the screen isn't letting me. Oh, there we go. Okay, so I don't want to talk too much about who we are, but like I said, we're from New South Wales Health and we do a range of different things. We cover from Helensburgh in the north down to Durras in the south, and our main aim is to reduce the incidence of HIV and sexually transmitted infections, unplanned pregnancies and hepatitis. If you do want to find out more about what we do as a service, I'd highly recommend jumping onto our Facebook page. So we've got a Caddyshack Facebook page. We've also got a landing page. So if you go to the caddyshackproject.com.au, you'll be able to find our landing page, and on there we do monthly blogs, we do Instagram posts, we do Facebook, we've got a range of different things. So I'd highly recommend jumping on there and finding out more about what we do. We also do a lot of outreach work, so you might see us down at local parks, at beaches. So if you do see the Caddyshack sign, please come and say hello to us. There's 4 of us in the team, and we work across TAFEs, universities, lots of different places across the Illawarra Shoalhaven. So normally, like I said at the start, we do like to ask a lot of questions, and there's no such thing as a silly question. They're all valid. So what we've done for the sexual health component, there's a really good website called PlaySafe. So if you just type in PlaySafe into your browser, it's a health website. There's a range of different services that will come up for that. So they've got all different things on STIs. They've also got where your closest clinic is. So if you want to get an STI test, if you're not in the Illawarra Shoalhaven area, they'll be able to tell you where your nearest clinic is across New South Wales. They also have commonly asked questions. They've got blogs, they've got forums, all things around sexual health. So if you want to find out more, I recommend going on to there. But the biggest one of why I've put it on this slide is there's a really cool feature called Nurse Netty. So Nurse Netty, it's a confidential free service where a person will email in their question, and a sexual health nurse, a qualified sexual health nurse, will get back to that person within 24 to 48 hours, excluding weekends. So like I said, there's no such thing as a silly question. If you do want to find out things, just go on there and you'll be able to find out. So all you have to do is just put in your email address and your postcode and just a first name, but you could put whatever for your first name if you don't want people to know, but it's all confidential. So if you have any questions even from today, jump onto that Nurse Netty website and the PlaySafe website, and Nurse Netty will be able to help you. So I thought we could start with some myths and facts before I get talking around. I'm going to talk about an STI today, and I'm also going to talk about a bloodborne infection. So the first one is, can I catch a sexually transmitted infection from a toilet seat? This is a myth that is quite common. I'll let you guys have a little think about it to see if you think it's a myth or a fact. So it's definitely a myth. So you can only catch an STI from one infected person to another infected person. From one infected person to another person through sexual fluids or blood-to-blood contact or skin-to-skin contact. So no, you cannot catch a STI from a toilet seat. Does pulling out before ejaculating mean you won't get pregnant or get an STI? I'll let you have a think about that one for a second. That's also a myth, really common myth. So pre-cum, so when a man ejaculates, they could have pre-cum, and that can contain semen, which can cause an unplanned pregnancy, and also it could contain an infection if the person has an STI. So that's definitely a myth. The withdrawal method is not a reliable form of contraception and does provide protection. Although we can't exclude the withdrawal method for a form of contraception because people still use it. It's not as highly effective as some of the other contraception methods. I'm not going to talk about contraception today. However, if you do want to find out more about the different forms, such as like the combination pill, the most common that people would have heard about, but yeah, all the forms of contraception, we are actually doing a online WebEx on July 29th. So you can jump on there 10 to 12 and it's free as well. But I'll pop some information down the bottom so you can hear about it more. Okay, we've got two more and then we'll get into what we're going to talk about today. Can sexually transmitted infection be spread by oral sex? Yes, that's a fact. So a person with an infection can easily pass an STI during oral sex. So condoms are the best form of protection. I'm going to talk about them later in this slide, but looking at the male or external condom, the female or internal condom, and dental dams as well. But I'm going to speak about that at the end of today's session. Last one. Do you need to wear condoms when your girlfriend is on the pill? All right, I want you to really have a think about this one. So that's a fact. So the pill is a form of contraception. It's highly effective. It's 99% effective in perfect use. But when we look at ideal use, it's about 93 because we look at that human error. And it will reduce the chances of unplanned pregnancy, but the pill doesn't offer any protection from STIs. So if you don't know your partner's status, if you're not in a long-term monogamous relationship, I'd highly recommend using condoms as well, and it's that double protection. So condoms are the best form of protection, and we're saying that with the pill, there's all sorts of different ones, but there are things that can reduce the effectiveness. So if the woman doesn't take it within 12 hours, or she has severe vomiting or vomits within 2 hours or severe diarrhea, different medications will counteract the pill and it won't absorb. So there's all sorts of different factors, but we're going to talk about that in depth today. Okay, so the STI I'm going to talk to you about today is called chlamydia. So chlamydia is by far the most common STI in young people. So when we look at young people, we're referring to the ages of 16 to 29 years of age. So there's a fair few reasons why this could be a factor of why young people are the highest rate of infection for chlamydia. So it could be they may be not in long-term monogamous relationships, but the biggest factor in why why we're seeing it skyrocket is because 75% of people that have contracted the infection may not know that they've got it because they don't show any signs or symptoms. So there's only a small minority of people that have contracted the infection will show any signs or symptoms. So they may go out and have unprotected sex, not show any signs or symptoms, and then continue passing on that infection without even knowing because they're not showing anything. So that's a big factor that I want you to take into consideration. And it affects both men and women. So that's an important thing to remember as well. If people do show symptoms, for women, it's a slight discharge, pain when urinating, pain in the lower abdomen area, and when it gets severe enough, the woman can bleed during and after sex and in between periods because what the infection has done is started to erupt and start to affect the uterus. For men, it will be a clear, sticky discharge, but that's often mistaken for pre-cum. It will be pain in either one or both testicles and pain in the lower abdomen area, pain when urinating. But we're saying that not everyone will show signs or symptoms. If people do show symptoms, they will generally show them within 7 to 14 days after that unprotected sex of when they've contracted that infection. So the reason we're talking about it today is if it's left untreated, it can cause serious health implications later on in life. So if it is left untreated, what it can do, it can cause infertility. So a choice that you make now, we don't want it to have an impact and affect you later on in life. So for women, what it does, it starts to scar the fallopian tubes. And I'll show you just a quick diagram. So this is the women's reproductive system. So these things here are your fallopian tube or women's fallopian tubes. These are the ovaries. This is the uterus. And what happens is that infection, when it gets severe enough, it can start to scar these fallopian tubes. So they look like spaghetti. So they're not very big, they're small, and it will start to scar. So then what happens is there's no possible way for the egg and sperm to meet, causing that infertility. And for males, it can start to affect the vas deferens tube. So the vas deferens tube is a tube at the back of the testicles, and that can cause the swelling, and that's where the semen comes up into the penis. Good news is, though, it's really easy to test for and really easy to treat. So to test for chlamydia, it's just a simple pee in a pot. So a quick urine sample. It will look something like this. It gets sent to pathology and gets tested. So that's majority of the time, that's how they'll test. Sometimes they may do a swab, but majority of the time it will be a simple urine sample. And to treat, it is just 2 antibiotics taken orally and then no sex for 7 days. So you've got to give a chance for the antibiotics to work in the body. And then they more than likely will test within a 3-month period just to make sure that infection hasn't reoccurred. Because your immune system's down, you're more likely to catch something within that 3-month period. So where can you get a test? We're really lucky in the Illawarra Shoalhaven. We've got a sexual health service at Port Kembla Hospital. So it's within the Port Kembla Hospital, right near emergency there. They're open Monday to Friday, 9 to 5. It's a completely free and confidential service. So you just need to call up and make a booking. And we also have one down at Shoalhaven Hospital as well. They have limited capacity at the moment, but they are still a service down there that you can use. But if you go onto PlaySafe, if you're not in the Illawarra Shoalhaven, you can find your local area, or any GP can do a sexual health screen as well. So there is a lot of myths around STI testing, that they're painful, they're expensive, and the answer is they're really easy. So it's majority of the time it's a simple urine swab, this urine sample, or a blood test for things like HIV, syphilis, and hepatitis C. So most of the time you won't have to show your genital area either, so that's a concern of some people. The only time that you will have to show your genital area is if there's a rash or a lesion that you may be concerned about. They will also ask a few questions. It's not to be nosy, it's just to find out what sites to test for and what sort of STIs to test for as well. But if you want to find out more, I highly recommend going onto the PlaySafe website. The Port Kembla Clinic, they also do a thing called partner treatment. So if you are in a relationship, they'll do treatment for your partner as well. All right, the last one I quickly want to talk about is hepatitis C. Okay. So hepatitis C is inflammation of the liver, and it can be passed through an infected person through another through blood-to-blood contact. And 25% of people will clear the infection up on their own, but 75% of the people will develop chronic hepatitis C if it's left untreated. Good news is there is a cure. 95% of people that have takes medication are cured from the hepatitis C. But looking at some of the symptoms, they include fatigue, sleeping problems, flu-like symptoms, mood swings, anxiety, depression, feeling sick, poor appetite, indigestion, skin rashes, itchy skin, dry eyes, dry mouth, and more mouth ulcers. The best form of protection is not sharing needles. So if you are engaging in intravenous use with drugs or steroids, it's really important not to share the same equipment. You've got to have different equipment, or your things like backyard tattooing or unsafe tattooing, maybe in other countries. So the Australian government have a really good practice around safe tattooing, but just making sure that those needles are clean if you are getting tattoos overseas. And yeah, it's easily to test for. It's just a simple blood test, and then treatment is also available. Okay, so with the condoms, to prevent STIs, the best form of protection is condoms. So looking at the male condom first. So because it's a medical product, they will have on there the date that they were made, and it will also have an expiry date. So all condoms are about 5 years. Really important to keep them in a dry area out of the sun. So we don't want them in glove boxes because friction or heat can cause them to deteriorate. And they're 98% effective in IUD use, but I always go off real life because, we're human. We all make mistakes. If they're, like I said, left in heat or friction, it's about 88% effective. Next, we've got the female condom. So these are a little bit less. In real life, they're about 79% effective, and this is inserted into the female's vagina, but not doubling up. So if the male's wearing one, then the female won't wear one. So that's another option. And then your third one is what's called a dental dam. So a dental dam is used during oral sex to prevent your skin-to-skin infections. So things like genital warts or genital herpes. So it's just a thin latex sheet. They're not readily available in Australia, so if you don't have one, you can use a condom as well. Just cut it at the tip and then cut it down the side. So they're your 3 protection measures to prevent against STIs and unplanned pregnancy. So I hope you got something out of today, and I hope you found it beneficial. But like I said, if you do have any questions around sexual health, I'd highly recommend going onto the PlaySafe website. They've got all the different ranges of STIs, what the symptoms are, what the treatment is, where the clinics are. and also the Caddyshack landing page. So if you just go to the Caddyshack project, it will come up there. All right, thanks for your time. Next, you're going to hear from Anna. So Anna is a clinician at Headspace, and she's going to talk to you for the next 15 minutes. All right, thanks, guys. Oh, that's just another link. So you've got Nurse Nettie, and then there's also a sexual health info link, so you can call them and talk to a sexual health nurse. So that's 1800 451 624. All right, thanks, guys. I'm going to put Anna on now. Thank you.
Hello. Hi, so I am Anna. I'm a social worker from Headspace in Wollongong. I work with families and I also work with young people individually. What I want to talk to you about today is what you might want to look out for in yourself or a friend if you're concerned about mental health issues. I'm going to talk about what you can do if you are concerned about yourself or someone else, and I'm also going to talk about where you can go for help if you need to and how easy that is. So now I've just lost the button. There it is. So this is what I'm going to cover. I'm going to cover what depression and anxiety look and feel like, and the reason for that is because they are the most commonly experienced mental health problems. What to do if you or someone you know seems to be struggling, and where to get help, as I said. So why your age group? Why are we coming and talking to people like you? And why is there somewhere like Headspace where we work with people aged 12 to 25? And that's because 24% of young people will have a mental health problem during their adolescence to 24. And the problem with this is that it can affect you long term. Even if you only have one episode in that period of time, it can affect your cognitive, so your brain, the way your brain works, and therefore how well you do at school or TAFE. It can affect your capacity to socialise with people and have good social relationships. And in some cases, it can affect your long-term mental health. So you need to get help for yourself or for someone else when you can, when you're young, so that you can actually avoid some of these problems. So anxiety. Anxiety is where somebody has a persistent or irrational fear. So everybody feels a little bit of anxiety from time to time. You know, you've got a test coming up. You're meeting a new person on a date or something like that. We all get a bit nervous, which is okay. But anxiety is when there is a persistent and irrational fear. So it's something that you've got no real reason to be worried about. So, for example, spiders. I know lots and lots of people are pretty anxious about spiders, but the majority of spiders in Australia aren't actually dangerous. In fact, the majority of the ones you come across are never going to actually hurt you, but a lot of people are still really stressed out about them. So that's an anxiety about spiders and a phobia about spiders. But for some people, it's about something that's much more frequently and commonly experienced. So for some people, it's a social anxiety where they're anxious about seeing or talking to other people because they're anxious about being judged. And that might prevent you from going to school or TAFE or to other places where you need to be. What happens when we experience anxiety is we have what's called the fright, flight or freeze experience. So that means that we get this rush of adrenaline all the way through our body. And that rush of adrenaline creates our heart beating faster. So when you're really anxious, you might feel your heart sort of beating even though you haven't run up a flight of stairs. It sends all our blood through to those large muscle groups, and that's so that you can fight or you can run faster. So then the other thing is that it might affect your ability to think. So what happens is the blood flow that's going all the way through your body goes into your head, but it stops going to that really intellectual part of your brain, the part of your brain that you use when you're doing maths, for your horticulture, or when you're doing working out, you know, how much wood you're going to need to build something. That part of your brain stops being effective, and the only part of your brain that works is the amygdala, or that very middle part of your brain. And that's the part of the brain that we've had since we were cavemen, in fact, since we were lizards. And that part of our brain only does things that helps us live, helps us survive. So it does things like breathe, eat, drink, sleep, look after ourselves. And so in that moment of absolute panic, when we've got the adrenaline rushing through us, it tells us quickly whether we can fight the situation, whether we can run away, or whether we need to freeze and kind of hide. And this can be really problematic because, for example, if you're in a classroom and you're really anxious about people making fun of you or judging you, and the teacher asks you a question like directly, then that can cause this rush. And you might behave in a way that you never normally would towards the teacher. You might tell them where to go. You might freeze, or you might just leave the room. And all of those things are going to affect you in the longer term. So this is something that we need to get you help for. And it can happen in different levels. For some people it's mild and it makes them feel sick. For other people it's really extreme. Now I can't get the page to move on. So the other thing you might notice if you're experiencing anxiety is that you might feel a bit sick in the stomach, and that's because the adrenaline stops your whole system from working. So you don't need to be digesting food when you're trying to make those decisions about whether you're safe. And it can give you like a stress around your shoulders and back because you're sort of tensed up. It can give you headaches because you're not using that part of your brain, and the blood flow has stopped to that part of your brain. And it can have a really big impact on your ongoing experience of life. So here's some of the things you might notice. Just have a read, but that you might notice them in you. So you might feel more nervous. You might feel like asking more questions about what's happening around you because you're nervous about it. You might be struggling to hand in assignments, or you might be aggressive, or you might not want to attend school. But the other thing is, these are all things that you can notice in a friend or someone that you care about. And if you do notice these things that are happening in a friend, and they seem to keep happening, it's not just on one day, it's like for 2 weeks, 3 weeks, then that's something that you might want to be a little bit concerned about. The next one that I really want to talk about is depression. And the reason why I want to talk about depression is that 10% of people aged 12 to 25 will experience it at some point in that time. Depression, we all know, is a low mood, but it's also a loss of interest in things that you used to find really enjoyable. And if this happens for up to 2 weeks, then it's something that probably needs to get checked out. One of the challenges for noticing this in young people is that young people are super good at putting on like a pretend mask and pretending that everything's okay when inside they're really struggling. So if you know someone really well, it might be something that you pick up, but definitely in yourself, it's going to be something that you pick up. And on the side there is just the sorts of things people say to them in their head, in their own head, when they feel depressed. There's a lot of really negative self-talk in that time. So these are the changes that you might notice. So being isolated, so even though you're still hanging out with the same people or you're still going to TAFE or whatever, you feel like you don't have any friends even though you used to have some. You stop being sort of calm and kind of easygoing, and you start being really irritable and easily upset or angry. So everyone at home is just driving up the wall, or everyone in class is just, pushing your buttons. You feel really low in energy. And the thing about depression is it doesn't just affect your brain. It actually affects your whole system. So it's not just your mood that's depressed and your ability to think that's depressed, but it's actually your whole body that's depressed. So it can feel like you're walking through mud. Being sad, obviously that's one of the most obvious clues. Sleeping either too much or not enough, but always feeling really tired, and not getting any happiness out of things that you used to enjoy. So someone who used to come to soccer and play soccer every week, or come to training, or someone who used to come and hang out on the weekend, just sort of stops doing that, and you notice they haven't been around for a while. What can you do? So if it's yourself, if you feel like you're beginning to go that way, then basically just be nice to yourself. Treat yourself as you would a best mate. Remind yourself that there is help available, and we will go into that. Don't forget to exercise. All the research tells us that exercise is one of the best preventative and treatment measures you can take if you're beginning to feel depression, particularly in those early phases. Eat healthy food. So I know that Macca's is pretty good, and Chico's is all right, and it feels good when you're not feeling too awesome about yourself. But what you need to be doing is making sure that you're getting, your pieces of fruit, your vegetables, a healthy piece of meat on a regular basis, just so that you're keeping your system going well. And we know the link between body and mind, and we know that it's really important to keep that going well. Tell someone you trust. So if there's a family member, anyone, it doesn't have to be your mum and dad, it can be your granny, it can be your brother, your cousin. Just tell someone you trust about what's happening for you. You can visit or call a service like Headspace, and I'll go into some of the other services soon. Or you can call a helpline, and there's lots of those available. There's like Men's Line, there's Kids Helpline, there's the Headspace, e-Headspace phone numbers, and I'll give you some of those later too. If it's someone that you care about, like your best mate or a family member, ask them how they're going, so sort of say, that are you okay day? You can actually do that any day of the year. So you can say to someone, what's happening, mate? Are you okay? Often people will say, particularly young men, no, I'm fine, mate, I'm fine, to start with. Good idea to keep an eye on them. And if in 2 weeks you haven't noticed any changes or they've gotten a bit worse, then ask them again, but this time point out something that you've actually noticed. So, are you sure you're all right, mate? I haven't seen you at footy for a few weeks now. Or, are you sure you're okay? You don't seem to be turning up to work as much as you used to. And that prompts them to actually have to explain to you what's happening for them, which can be a really useful way to find out more information. Encourage exercise and eating well, even if that means you going for a run or a walk or whatever with them, and encourage them to eat healthy food. If you're really concerned about the person, tell an adult that they trust. So hopefully you'll get their permission, but if you are getting really worried, make sure you find an adult and tell them. And that can be like one of your TAFE teachers, or your boss at work if they're a good person, or a parent or a family member. Visit or call a service again, so call Headspace, go to a doctor's office, even go to like your local youth centre or community service. They're all available to help. Or call a helpline, and they're the same ones I mentioned before. So these are those places. So obviously I'm going to tell you to come to Headspace, but that's because we're a service that's specifically designed for people aged 12 to 25. Go to family, go to any GP, and the beauty of GPs is they're like the doorway to all services that are available, whether it's for physical health or mental health. Go to your centres, or call the mental health line, which is the 1800 011 511 number there, and that's statewide, so it's all of New South Wales, and it's 24 hours a day. And once you've explained to them what's happening, they'll tell you what to do next, which is a really terrific service that New South Wales Health provide. So, Headspace. We can help with physical health. We have GPs. We can help with mental health, obviously, and counselling. We can help with sexual health and contraception. We can help with alcohol and other drugs. And we can help with advice about other appropriate services. And that means that if you come to Headspace and whatever's happening for you, we're not the best service to support you, we will find the best service to support you, and we will help you get there. So we're not just going to go, oh no, find yourself something. We're going to actually help you get there. We also have lots of groups and activities. So we have weekly and fortnightly groups. So the groups include Community, which is for ages 13 to 5, and Rainbow League, which is 16 to 25. And they're for people who are in the LGBTQI group. We have a gamers group, which, as it's suggested, is for people who are really into gaming. We have a couple of different anxiety groups. One is really short, and the other one goes for, I think it's 6 to 8 weeks. And they're education groups, but also treatment groups. The good thing is you don't have to sit there sharing all your information about who you are. It's really just them talking to you about what can help. We also have a really popular support group for the parents of trans young people, which is really helpful. And the people who go to that really, really value it. And there's also a youth reference group. So if you feel like you might want to help out with what we do, whether that's to attend things for us or just give us ideas about what we could be doing better, you can apply to become a member of the youth reference group, and we really value those people as a really good help. And we need more men in that area. A lot of these groups are actually still running at the moment, even though we're not having people come to the centre, and they're running online, which is great. So this is a group of people from our youth reference group. There's more than that, but that's a group of them. Now, how to make a referral. This is super easy. It's not something that's going to be tricky. So you or your friend or a parent or a teacher or a counsellor or your second cousin twice removed, anyone can call, email, drop in. You can complete the referral form on our webpage if you want to, but you don't have to. Anyone can refer someone as long as the person wants to be referred. From there, we'll make a phone call and just have a chat to the person and work out what's happening for them. And we will also let you all know that Headspace is free in Wollongong, Nowra, Goulburn and Bega. So they're the 4 centres that the organisation I work for currently manages, and it's a really important thing to us that we make access free so that nobody is prevented from coming to Headspace. The final thing I need you to know is that if it's a little bit scary for you to come to a centre or you've never spoken to someone in that way before and you want to get an idea of what that's like, or you just feel like you need to talk to someone, if you go to eHeadspace, which you can find at headspace.org.au, you can either do instant messaging counselling, you can do email counselling, or you can do phone counselling. You can organise to talk to the same person for a few times in a row, and it's just a really simple chat about what's happening for you, and they'll give you ideas about what you can do to help yourself or your mate. And parents can, if you know of someone's parent who needs somewhere to go, that's something they can do as well. The beautiful thing about this service is if they are really worried about your mental health and your safety, they will, with your permission, give us a call and say, hey, can you follow up with this person because we're quite concerned about them. All the information I've just given you is also on the Headspace website. So again, it's headspace.org.au, and you can go on there and just have a look at it, and parents can too. It's a really good website. So that's all from me. Next up is Pippa, and she's going to have a chat with you about drugs and alcohol. All right, see ya.
Hi everyone, my name's Pippa. I work here at the Drug and Alcohol Service in Wollongong. I'm going to talk to you today about drug and alcohol affected driving. It's really important to understand the effects that drug and alcohol have on our ability to drive, what the laws and penalties are around drinking and drug affected driving, and I'm going to explain all of that to you today. So here in Australia we have a really strong culture when it comes to drinking. 16 out of 18 AFL clubs in 2009 were sponsored by alcohol companies, and there are other clubs and sports sponsored by alcohol, including the NRL. As well as that, just in ourselves, we have a strong culture around alcohol. We meet at the pub after work to have a few drinks with our friends, or we might have a barbecue, invite people over, and it always involves some sort of alcohol and drinking. So with this culture comes consequences, and in those consequences is the fact that drink driving is one of the biggest killers on our road today. So in Australia, 9 out of 10 drink drivers are male. This might be because when we go out drinking together, males and females, it's often the male that will drive. They have this sort of protective nature. They might want to drive. You both might have been drinking and they say, oh, I'm more sober than you, let me drive. But it is a fact that 9 out of 10 drink drivers are male. And 79% of these are under 50 years old. So in 2018, 1 in 3 fatal crashes in Australia involved alcohol. This might have been a drink driver who was killed driving home, but it can also include the drink driver's passenger. It can include someone who is just walking home on the street that is hit and killed by a drink driver. There's lots of different scenarios that includes. So what is your blood alcohol concentration? Your blood alcohol concentration is the number of grams of alcohol per 100 mils of your blood. This is what comes up on the breath test machines when you're breath tested, and it's the amount of alcohol that is reflected in your blood alcohol concentration that comes up in that number. So we know that your blood alcohol concentration begins to rise as soon as you start drinking, and it can continue to rise for up to 2 hours after you've stopped drinking. So it's important to know this because some people feel that once they stop drinking that it just starts going down and you're going to start sobering up. That's not the case. It actually keeps going up for at least 2 hours. There are a couple of factors that can affect what your blood alcohol concentration is. So age and gender are factors. It's known that men have more water in their bodies, so this dilutes the alcohol more for men than it does for women. Health and fitness. So your health of your body dictates how quickly you metabolize the alcohol. If you're a fairly fit person, your metabolism can be quicker, so it can metabolize the alcohol quicker and get it out of your system quicker. Your tolerance to alcohol. If you're a regular drinker, you won't get as drunk as someone who doesn't drink alcohol and is drinking the same amount. And also other drugs and other medication that you're taking. If you start to drink while you're taking these drugs or medication, that can really affect your blood alcohol concentration as well. So what is a standard drink? We've all heard the term standard drink, but what does it really mean? So a standard drink contains 10 grams of pure alcohol. And you might have seen the pictures on the left. The top one shows a standard drink is the drink you're drinking might be one standard drink, and you can see this on cans or bottles of alcohol that you buy at the bottle shop. But what about the ones in the picture below? How do we know how many standard drinks each of those are? It's quite difficult to know, especially if you're not pouring the drink. So I'm going to give you some more information on that. So different types of alcohol contain different amounts of pure alcohol. It also depends on the size and types of glasses that the alcohol is in. So looking at the picture on the left, if you have a standard white wine glass, 150 mils of white wine, or about half a glass, is 1.4 standard drinks. If you have a full strength beer in a schooner, that is 1.6 standard drinks. And then if you have 1 nip of spirits, that is 1 standard drink. So it's very confusing about what each alcohol, how many standard drinks is in each alcohol that you're drinking. It depends on if you're having middies, if you're having schooners. And I mean, realistically, who has middies when they go to the pub? Everyone's drinking schooners. And it depends if the people pouring it are pouring it to the right size. Often when we pour at home, we're not measuring how much we're pouring. We're just pouring it into whatever sort of glass we have. So it's important to try and understand how much you're drinking. Now you can do this by checking the labels on cans or bottles, but if you have a glass, it's a much more difficult process. In Australia, police conducted over 5 million breath tests in 2019. So a random breath test is when you get pulled over for either a passive or a mouthpiece breath test, and every police car has a breathalyzer in it. So if you're driving any kind of vehicle on the road, which can include a car, a motorbike, a taxi, a bus, or even a truck, you can get pulled over for a random breath test. Now, drink driving is a crime, so there are penalties if you are caught drink driving. If you're an L or a P plater, you are not allowed to have any alcohol at all in your system. You have to have a blood alcohol concentration of 0. If you drive trucks or buses or taxis, you must have a blood alcohol concentration of under 0.02. And if you're a full licensed driver, you must have a blood alcohol concentration under 0.05. So what does it mean if you are over that? What are the penalties that you can receive? So If you're an L or a P plater and you are pulled over for a breath test and you record a reading of between 0 and 0.02, the first time you're pulled over, you will lose your license immediately for 3 months and you will get a fine of $572. So you will not be able to drive from the scene. They'll take your license straight away. You'll have to find an alternate way to get home, and you can't drive for 3 months. So that can really impact your work, your family, your life. And if you repeat this, if you get pulled over a second time and you get a breath analysis of between the same levels, you can get your license suspended for 6 months, and you have to get an interlock system put in your car for 12 months. So an interlock system is a device that goes in your car that you have to breathe into every time you want to start the car. It can give you warnings while you're driving that you have to pull over and blow into it to make sure you're still under the limit, and it's very expensive. You have to pay for it to be put into your vehicle, you have to get it calibrated regularly, and then you have to pay for it to get removed. So it's quite an expensive situation. Now, if you look at the graph there, there's the special range. That's for people who are truck or bus or heavy vehicle drivers. And then the full licensed drivers, you can fall between low range, mid range or high range. And as you can see, the penalties increase for each range. And as you become a repeat offender, if you keep doing it, they just keep getting higher and higher and higher. Okay, now I'm going to talk about drugs. So we have illegal and legal drugs. So some examples of illegal drugs are cannabis, heroin, methamphetamine, ecstasy, LSD, steroids. And some example of legal drugs might include alcohol, caffeine, or even prescription medication. So drugs can be put into 3 different categories, and each category depends on how it affects our body. So with depressant drugs, they slow down your central nervous system. This means your reaction speed is a lot slower, you have reduced concentration, you're a lot drowsier, and some of these drugs include alcohol, cannabis, and heroin. So you can imagine what this means when you're driving and trying to react to things that happen while you're driving. It can be a lot slower process. Whereas stimulants, they're the opposite. So stimulants will speed up your central nervous system, make everything faster, you'll drive more aggressively and dangerously, you might be distracted, you're going to hit the accelerator a lot more, you want to go quicker, everything speeds up. So some of the types of drugs that this includes are amphetamines, cocaine, and ecstasy. And then the third type that we look at are hallucinogens. So these distort people's perception of reality. You might see things that aren't really there, blurred vision, confused thinking, and some of the drugs that are hallucinogens are LSD, magic mushrooms, and ketamine. So these also distort your ability to drive. But one kind of drug that we really are probably most likely to use is prescription medication. So prescription medication can affect you driving. There's an increased risk of a crash if you are taking more than one medication at a time, and also if you're combining medication with alcohol. So if you look down on the pictures, you'll see some of the bottles and boxes there have warning stickers on them. So these warning stickers might advise you not to operate heavy machinery while you're taking the medication. And heavy machinery can include a vehicle. It's not just a crane or a big truck, it's actually a vehicle. So what we recommend if you are going to take some medication is to ask your pharmacist or doctor some questions. So some of those questions might include if it's safe to drive whilst taking the medication. You might want to know what the medication is for and what the side effects might be, how you're supposed to take the medication. And you can always ask for a patient information leaflet if you want more information. So you just need to make yourself aware of what it's safe to do while you're taking the medication. In Australia, police have conducted over 200,000 mobile drug tests. A roadside mobile drug test is a station where they can pull you over for a saliva test, and every highway patrol car has a mobile drug test in it. Some of the drugs that can be tested on a mobile drug test, there are 4 different types. are cannabis, cocaine, MDMA, and methamphetamine. So if you get pulled over for a mobile drug test and it indicates that you have one of these drugs in your system, they will take you in for a saliva test, and that will get sent away to a laboratory for a more accurate result. So what are the penalties if that test from the laboratory comes back positive? So if you're a first-time offender, you'll lose your license immediately for 3 months. You'll also get a fine of $572. Now, you have 28 days to take this to court if you want to dispute it, and if you get found guilty at court, you can lose your license for 6 months and you'll get a $2,200 fine. Now, if you get pulled over, like we mentioned with the random breath testing, if you get pulled over and you're a repeat offender, you will lose your license for 6 months and the fine goes up considerably to $3,300. So what are some of the things we can do if we're going to go out and we're going to drink alcohol or we're going to take some kind of drug? What can we do instead of driving? So there is a Plan B campaign. The campaign began in 2012 and it's all about making some positive choices to get home safely after you've been out. So it's designed to get you to think about other options to get home. Some of these Plan B options can be a taxi or an Uber, a sober driver, someone that's out with you that isn't drinking, or even someone that you can call to come and pick you up that you might have spoken to earlier, like a friend or your parent or a relative. Consider staying the night. So if you're drinking at someone's house, they might offer for you to stay the night. That way you don't have to drive, and even the possibility of catching public transport. But the most important thing is to make the Plan B before you go out. So if you know you're going to go out and you're going to do take some drugs or you're going to drink some alcohol and you can't drive safely, you need to make the Plan B first. And the way we talk about that is if you are going out, leave your car at home, catch the taxi or the Uber to the pub. That way, once you've had a few drinks, you don't feel like you want to drive home and to get your car home, because sometimes those decisions aren't made very rationally when you've had a few drinks. Okay, I'm going to ask you a couple of true or false questions to see what sort of things you've learnt during this presentation. So the first question is that alcohol is a drug and you can overdose on it. So think about it. Do you think this is true or do you think this is false? So this is a true question. Alcohol is a drug and you can overdose on it. So alcohol poisoning is when the level of alcohol in your body is so high that it can collapse your automatic nervous system. Now this is what controls your breathing, the signals to your brain, and it can lead to suffocation and you can even die. And one more, true or false question. A cold shower, fresh air or coffee will sober you up. I'm sure you've heard this many times. Think about it. That's false. So you might feel less sleepy if you do one of these, but the only way that you're going to get alcohol out of your body is with time. And many different factors, like we spoke about before, will determine how drunk you feel. Your weight, your age, your gender, health, all those things are going to make you feel different, but the only way you're going to sober up is time. Okay, and here we have some information about our service. So we're the Illawarra Shoalhaven Local Health District Drug and Alcohol Service. If you want to get in touch with us for some inquiries or some assistance, you can call us on the phone on 1300 652 226. We're located here at the Arana Centre at 2 Rawson Street in Wollongong. Or you can get on our website. There's some information on there about services and programs that we provide. There's all sorts of things we do here with treatments and counselling. If you want to speak to anyone. I'll just close that. There we go. But yeah, so if you need to contact us, this is how you do it. Now I'm just going to hand you back over to Caitlin just to finish up. But thank you for listening. Hope you learned something.
Hey again. So thanks Anna and Pippa for amazing educational videos. I hope you all learnt something from today's session. At the end, I've also put a little link in for a quick evaluation. So because this is a fairly new program, I really like your feedback, positive, negative, how we can change things, what you'd like to see. So if you could fill that out, it will take less than a minute, so that would be greatly appreciated. All right, and thanks for your time, and you might see us around campus later on in the year. All right, thank you.